Hello, everyone. This is Eladio Pereira here at Mariposa Community Health Center in Nogales, Arizona. I'm the Chief Medical Officer at Mariposa. And today we're actually going live. So we apologize for any mistakes we may make. I want to thank Edgardo and Mariposa for making this possible. This is meant to be an educational session for our patients and those residents in Santa Cruz County, Arizona. And this is Cervical Cancer Awareness Month. And I wanted to take a few moments to continue to encourage screening for cervical cancer. Unfortunately, we still see women occasionally coming in late and diagnosed relatively late because of no cancer screening. And I think over the last several years, the recommendations have changed. The American College of OBGYN has changed their recommendations. And before I say anything more, it's best to consult with your clinician to make sure that the test is done correctly, that the frequency is the one recommended, and everyone is different, of course. But there are some guidelines that we follow. And those are the ones we're going to discuss briefly today. I'm going to do it in English first, and then I'll switch to Spanish for our Spanish audience. So typically, cervical cancer screening is not recommended under age 21. There are a few exceptions to that. It's best to consult a clinician if you believe that you should have screening before that. And then we do the pap smear or the cytologies to look at the cells of the cervix. We typically do that starting at age 21 through 29, and that's done every 3 years. In the old days, it was once a year. That's no longer recommended. Typically, it's every 3 years, unless the pap smear is abnormal. And again, you should consult your clinician to determine if the pap smear should be done more frequently. And then between age 30 and age 65, there are a number of options, and you should discuss that with your clinician. You can do what's called co-testing, meaning do a test like the pap smear along with the HPV, or the human papillomavirus, which is the virus that is considered to be the cause of cervical cancer. And that's typically done every 5 years. You can also choose to do HPV testing alone, and that's every 5 years as well. But if you just do the pap smear, that's every 3 years. So you can do pap smears all the way through age 65, every 3. However, if you choose to do co-testing or HPV alone, that would be about every 5 years. For women 65 and over, depending on the number of negative pap smear, the cervical cancer screening may stop. But again, you consult your provider before that's done. So those are the general recommendations. If you have any questions, please consult your healthcare providers. I'm going to switch to Spanish, if I may. Buenos días, mi nombre es Eladio Pereira, soy el director médico de Mariposa aquí en Nogales. Este es el mes de crear conciencia para cáncer del cuello de la matriz. Las recomendaciones han cambiado en los últimos años. El Colegio Americano de Obstetricia y Ginecología recomienda que el Papa Nicolau o la prueba de citología no se haga antes de los 21 años, a menos que hay una razón, y hay varias excepciones a esa regla, pero en general no se recomienda antes de los 21 años. Entre los 21 y 29 se recomienda el Papa Nicolau o la prueba de citología, donde se obtienen las células del cuello de la matriz cada 3 años. Entre la edad de 30 y 65 hay varias opciones. Se puede hacer las 2 pruebas del virus papiloma, que es el responsable del cáncer de la matriz, con el Papa Nicolau, y si se escoge esa opción, se hace cada 5 años, o se puede hacer la prueba del virus papiloma cada 5 años, pero si escoge el pap smear o la prueba de citología, esa continúa cada 3 años. En general, no continuamos pruebas de cáncer del cuello de la matriz, después de los 65 años, si se ha hecho varias pruebas que han salido negativas. Siempre es bueno consultar con su médico o su enfermera practicante o nurse practitioner para determinar cuál es la frecuencia apropiada para usted. Y eso es las recomendaciones que tenemos. Muchas gracias por escucharme. Nos vemos la próxima vez. Thank you everyone for listening to us at Mariposa. Again, we love Nogales, Eladio Pereira, Mariposa. Thank you very much. See you the next time. Bye-bye.